My name is Dr. Andrew Kaufman. I'm the Mohs surgeon at the Center for Dermatology Care in Thousand Oaks, California. I'd like to spend a few minutes to explain to you how Mohs micrographic surgery works. If this dark area represents your skin cancer, we numb up the area. The entire procedure is all done under local anesthesia. We'll use an instrument called a curette to scrape out what bit of the cancer we can feel, because the cells which make up the skin cancer don't hold together as well as the cells of normal healthy tissue. So we scrape out what bit of the cancer we can feel, and that tells us where to get started. Then we take a 1 millimeter margin all the way around. A millimeter is a 25th of an inch, so it's about as narrow of a margin that we can cut. I take a 1 millimeter margin all the way around, and then we mark or map the area so I know how it's oriented on your skin. We then take the piece of tissue and flip it over and flatten it out so that in a two-dimensional plane I can see all the peripheral and all the deep margins. We cut through the plane and mount the pieces on glass slides, staining it and looking at it under the microscope. There we can see that we've cleared the tumor over here, but there's still tumor extending beyond the specimen in this area. So we go back just to this area and take a small amount more, just from the area involved with cancer cells, and mark it and map it, take the piece, flip it over, flatten it out, and then cut through it and mount the pieces on glass slides again, staining it, looking at it under the microscope. And I see that we've cleared it over here, but not in this area. So again, going back just to the area with involvement, take a little bit more, mark it, map it, flip it over, flatten it out, until ultimately we don't see any more cancer cells extending beyond the specimen. And that way we're able to trace out the roots of the cancer. And that's what provides Mohs such a high cure rate. But by doing the Mohs surgery, we're able to provide the highest cure rate for our patients for most of their skin cancers, and also the smallest surgical wound for the reconstruction. Most of the reconstructions are performed here at the Center for Dermatology Care, whether that be a side-to-side repair or a flap or a graft. After the cancer's out, we'll take a look at the wound and decide what's going to be the best option for reconstruction. Of course, if the patient prefers to have another doctor perform the repair, we can help coordinate that, where we will clear the tumor and then bandage the patient and send them to the other doctor for reconstruction. But the vast majority of reconstructions are performed here by myself at the Center for Dermatology Care. For more information, please look on our website at www.emohs.com. Thanks very much.